Hi, I'm Hannah Watkey. I'm the physician assistant student. I'm going to be performing an abdominal and musculoskeletal examination today. If you don't mind, please remove your shirt, socks, and shoes and empty your bladder. And I just washed my hands. You're going to lay down with your knees bent, please. I'm inspecting the contour of the abdomen and noting any signs of scars, striae, distension, pulsations, masses, and the condition of the umbilicus. Okay, I will now auscultate for bowel sounds in all 4 quadrants. If I do not immediately hear bowel sounds, I will listen for up to 1 full minute in all 4 quadrants. The bowel sounds are normal, active. Okay. I will now percuss in all 4 quadrants, noting the sounds of tympany or dullness. Okay. Okay, and I will now percuss for splenic enlargement at the anterior axillary line of the lowest intercostal space. Please take a deep breath. Okay, very good. I will ask the patient if they have any pain and ask them to point to the area of pain, and then I will palpate that area last. You don't have any pain? Okay, great. I will now do superficial palpation in all 4 quadrants. It's about 1 centimeter deep, looking for superficial masses or distress in the patient's face. Okay, I will now do deep palpations about 4 centimeters deep, looking for deep masses or signs of distress in the patient's face. Okay, I will now palpate for liver enlargement, masses, or tenderness. Okay, so I'll just have you take a deep breath. Okay, let it out. Take another deep breath. Very good, let it out. And 1 more. Very good. Okay, now I will palpate for splenic enlargement. Okay, take a deep breath. Relax. Okay, take a deep breath. Very good. Okay, now have you sit up, please. I will check for CVA tenderness bilaterally. And I would perform a rectal exam at this time. Okay, now have you stand up, please. Okay. For this examination, I will inspect for symmetry. I will inspect and palpate for symmetry, signs of inflammation, edema, effusion, deformities, abnormalities, abnormalities and malalignments of the bone. Then I would also look for tenderness, muscular atrophy. I will look at the condition of the surrounding tissue, crepitus, and ease of range of motion. Okay, so if you can just stand like this for me. Very good. Okay. Okay. And then I'm just gonna have you face forward so I can look at you from this side. Very good. Okay, and then I'll have you face that wall. Oh, the other wall, sorry. Okay, let's see. Okay, very good. Okay. Okay. No tenderness or anything.
No.
Okay. Okay, very good. And now I will have you look forward. Okay, and I'm just gonna have you flex your neck so I can look at cervical spine. So actually look all the way down, chin to chest. Very good, and then extend it, so looking back. Very good. And lateral rotation, so side to side like this. Very good. And then just try to have your chin down a little bit. There you go, now do it. There we go. Okay, and then lateral bending, so ear. Okay. Very good. And then I'll have you do the lateral rotation one more time with me in front. Very good. Okay, so before I go to the rest of the spine, I'm actually going to do the temporomandibular joint. So I'm going to have you open your mouth and close it. Okay? Then I'm going to have you go like this and then pull back. Like. So out and then back in. There you go. And then I'm going to have you do lateral. There you go. Very good. Great. Okay. So, there you go. And that was protrusion and retraction of the temporomandibular joint and lateral side to side. Okay, so next I'm gonna have you, we'll have you turn this way because you can't bend there because of the bed. So I'm gonna have you bend down as far as you can go, like touch your toes. Very good, okay, and then extend, so like all the way back, as far back as you can go. Very good, then I'm gonna have you turn to one side. Which side do you want to go to first?
This side.
Okay, then the other side. Okay, and then I'll have you lateral bending, okay, into the other side. Very good. Okay, so, perfect. I will now inspect the shoulder, so I will look at the clavicle, the scapula, the acromioclavicular joint, the acromion, and the proximal head of the humerus. Okay, and I will look at it on this side too. Okay. Very good. I will inspect the arm, the biceps and the triceps, the antecubital fossa, the acromion process, the lateral and medial epicondyles of the humerus, and I'll have you go like this, and the proximal head of the radius. Okay, very good. Okay, inspecting, very good. Okay. I will now inspect the carpal bone, so I'll have you turn your hand this way. And the radial and ulnar styloids. Okay, very good. I will inspect the anatomical snuff box. So I'll just have you go like this, like thumbs up. Okay, and let me check this side for the radial and ulnar stylus and the carpal bones and the anatomical snuff box. Okay, and I'll look at the metacarpal bones and the joints that they form. Okay, let me see these. Very good. And now I will look at the interphalangeal joints of the fingers. Very good. Okay, now I will palpate. I will palpate the scapula, the clavicle, the acromioclavicular joint. Very good. And the bicipital groove and its tendon. Very good. And now on this side. Okay. Okay. Very good. I will now palpate the acromion process, the lateral and medial epicondyles of the humerus, the distal head of the radius, proximal head of the radius, excuse me, and the antecubital fossa. Okay, and I'll do the same on this side. Very good. Okay. I will now palpate the radial and ulnar styloids and the carpal bones and the anatomical stuff box. So that again. Okay. This side. Okay, and then that again. Perfect. Now I will palpate the metacarpals and the joints that they form. Very good. Okay. And last, I will palpate the interphalangeal joints. Okay. Very good. This way. Okay, now I will do range of motion. So I'll have you look at me. Okay, we're going to do shoulder flexion, so arms all the way up. Very good. And then hyperextend, so all the way back. Okay. Then I'll have you do abduction, so all the way up. Ooh, hit the fan. Okay, there you go. And then adduction, so across your body. Very good. Then go like this. And we'll do internal rotation and external rotation. And then in front of you, let me take this off so I don't drop it. We'll do circumflexion, so you're going to go around. Very good. So now with your elbows, you have them out like this. So extension, very good, and then flexion, very good. And then I'm gonna have you keep them like this in supination, pronation. Supination, pronation. Very good, and do it one more time. I'm just gonna hold your arm, okay, go ahead. Very good, okay. And now this one, very good, very good. Okay, next I will do wrist flexion and extension. And then I'll have you do radial deviation and ulnar deviation. Very good. Okay. Next we will take, so you'll have you do this for thumb flexion and then finger flexion, so over. Very good. Then you'll extend your fingers. Okay, and then for the thumb, this is extension. Then you're gonna do, keep them in a 90 like this. There you go. And then you're gonna go like this, adduction, and then abduction on both of them. Okay, and then opposition. So you're gonna go like this, like this, like this, and like that. Very good. Okay, so move this. I'll have you lay on down for me. Okay. I will inspect the hip region and the anterior superior iliac spine and the greater trochanter of the femur. Okay, very good. I will inspect the lateral and medial condyles of the femur, as well as the patella, the patellar tendon, and the tibial tuberosity. Okay, very good. I will inspect the legs and calf, the Achilles tendon, the tarsal bones, the lateral and medial malleolus, and the calcaneus. Okay, very good. Okay, and then next I will look at the metatarsals and their bones and the joints that they form, and also the toes. Very good. Okay, now I will palpate the hip region and the anterior iliac spine and the greater trochanter of the femur, and I'll palpate the legs. Okay, then I will palpate the lateral and medial condyles of the femur, the patella, its tendon, and the tibial tuberosities. I'll palpate the leg and the calf, the Achilles tendon, very good, the lateral and medial malleolus, okay, the tarsals, and the calcaneus, okay, and then I'll palpate the metatarsals, okay, and the toes. Very good. Okay, so now we'll test range of motion. So if you don't mind straightening out your legs. Okay. Very good. And then I'm going to lift this up for hip flexion. And then I'll also have him bend his knee to see knee flexion as well, because the hip can go further this way. So just relax for me. Thank you. Okay. Then we're going to do external rotation, internal rotation. Okay. Oops. Then I'm going to do abduction, and abduction. Okay, very good. Then we'll do the other leg. Okay, and then bend the knee. Okay, and just relax for me, will you? Thank you. External rotation, internal rotation. Very good. And then adduction and abduction. Okay, very good. Then I'm going to have you lay on your side. So whichever side you want to start with first. And I'll have you extend your hip. So this way, behind, but keeping it straight. Okay, very good. And now the other side. So switch to the other side. Very good. Okay, so relax. Very good. Okay, now I'll have you lay back on your back, please. Okay, and I'll have you straighten your legs out as far as you can for knee extension. Very good. We did knee flexion before. And then last, I'll have you toes towards you, okay, for dorsiflexion. Then point your toes for plantar flexion. Very good. Okay, and then I'm going to chest inversion and eversion. Inversion, eversion. Okay, very good. And then I'm just going to have you point your toes. Okay, hold on, relax. So just point your toes. There you go, and then flex them towards you. Very good. Okay, so now I'll have you bend this leg for me. Okay. And I will. Okay. Okay. Very good. I'm noting the circumference of the leg at the thickest portion. Okay, and then I'll have you do the other leg, so bend the other leg for me. Okay. Okay, very good. And I also measured from the tibial tuberosity to the point of the thickest portion. And next I will use the goniometer. Okay. So, okay. I'm gonna have you flex your knee as much as you can, but keep it down. So flex it and then put it down. Perfect. Wait, no. Okay. Good job. Okay, very good. Okay. Okay, and then I'll have you do that. I'm gonna have you flip so it'll just be easier. Thank you. Okay, perfect. Do that again. So I will right there. Okay. And then there. Okay. Very good. Thank you so much.